All right. The clock has struck noon Eastern time. We can get
All right.
rolling. Thank you, everybody, for attending. People will continue to roll in, but as they do that, why don't we introduce ourselves, introduce the topic, and then we can dive right in. So, my name is Steve Alexander. I am head of growth at Anagram, joined by Dr. Kara Foster. Dr. Foster, why don't you give yourself a little bit of an introduction?
Thanks. Thanks for having me. I have been practicing for about 18 years or so. For the first several years, I practiced under the insurance kind of system. And I decided to open my own practice. And after opening my own practice, after a couple years, I decided to kind of drop insurance, go out of network. So we've been operating that way for quite some time now, and I'm excited to be able to share it with you guys, and also be excited to be able to do this webinar with Steve, because I really feel like Anagram is part of what helped me know that I could go out of network with just as easy as they make things. So I'm excited to be here and happy to answer any questions, because I also think it's a great way to be able to share with other optometrists as well. So thank you guys for joining us.
All right, thanks for that. The name of this webinar, of this event, is Optimizing Outcomes. The goal here is to help us understand how direct care practice can help you and your patients do a little bit better. As a practice owner, as an optometrist, to be a little bit more financially successful, and for a little bit more fulfilled with the better quality of care that you can provide. And certainly that's how your patient benefits as well. So a couple of months ago, Dr. Foster, you wrote an article for Anagram's publication Spyglass. Tell me a
Mhm.
little bit about it. What was the inspiration for it? What did you want to convey?
Really just kind of all looking at all the options going out, graduating optometry school, looking at all the different options that were available to optometrists. I mean, it's more than you think going in. And really just after exploring a lot of different options, and then even really trying some, thinking about residencies and going into different specialties, I really knew that I wanted to be under sort of a primary care eye care, so that I could spend more time with patients. And just work with them one-on-one, see the whole family. But after a while of trying that, I just felt like it wasn't sustainable. So that's why I decided to try this direct care. And I feel like direct care is more well known in primary care, not so much in eye care. But I think it's really doable in eye care. It's just figuring out for optometry how to make that possible. So
Excellent. And
yeah, so I mean, I think the
when you
article
say
was.
direct care,
Mhm.
sorry,
Oh, go ahead, sorry.
when you say direct care, maybe define it. How primary care defines it, and how you define it in your practice, and what you think that it brings to private practice optometry.
Yeah. Well, in primary care, it's really just eliminating insurance. I mean, a lot of primary care will do it as a monthly fee, not necessarily concierge, but just a more direct access to the doctor. It's supposed to bring more one-on-one time with the doctor and have a better trust and kind of better relationship between the doctor and patient. So I thought that we could kind of mimic that in eye care. So I came up with this kind of term, direct eye care. And I think it's really in eye care in general, in primary care, it's kind of a mode of practice that allows like staff and patients to experience true health care, strengthens relationships between the doctor and practice and the patient in a good way that really establishes trust. So, and in direct eye care, I think that we can do it in a lot of different ways, kind of modeling that direct primary care example.
Excellent. So, in your practice specifically, what does direct care mean? How is your day-to-day different now than it was when you were more in network, when you were dealing with insurances more directly?
Well, when we saw insurance, there was a lot, it was much more complicated when we were in network with insurances, long holds trying to get patient benefits, patients who only wanted to use their benefits in network, maybe didn't want to, or maybe wanted to, kind of just only use what their insurance plan covered exactly, coming in thinking it covered everything. Lots of extra explanations for patients with insurance. I mean, we all know kind of how that conversation goes. But now I feel like it's simple. As long as we've spent time explaining the way we are different at our practice, everything is just smooth sailing. We can see fewer patients. We can have more, I would say our days are more like joyful in general because the insurance conversation is gone. We explain it on the phone. We kind of reiterate it when they first come in, and then, it just it goes really smoothly after that, as far as like not having to re-explain insurance along every step of the way. They don't have to worry that they're getting a surprise bill at the end. So everybody knows the
I
straight
love
best. Yeah.
that you described it as a more joyful experience, and I suspect
Mhm.
that's true for you and your staff. I would also guess that that's true for your patients, right?
Yeah, absolutely. I think so. I mean, everybody seems to really enjoy coming in, and we enjoy seeing them. And it's nice because when you talk to them more, you can get to know them more and get to know their families, and we get a lot of more word of mouth referrals that way too. So
Excellent. Well,
yeah.
before I ask my next question, I just want to invite all of the attendees. If you have questions, you should have access to a Q&A panel. So feel free to throw questions in there and we'll ask them throughout the presentation. This is meant to be fully interactive. Um, so when you went toward direct care, when you started taking steps toward that, I guess, what was your sort of breaking point with the old way of doing things, and how did you start taking steps away from the vision insurances?
Well, I guess when I worked for the practice before I opened my own practice, I didn't really know the back end of it. All I really knew is that I was seeing a lot of patients per hour. And so I decided to open my own practice to be able to do things differently. So I opened it the same way and I said, I'm going to do things differently. And I did for a while. And then as you get a little bit busier, you realize, it's almost impossible, especially for a cold start practice, to wait so long for insurance reimbursements to come back, and then they're so pitiful. It's like, how do you pay the bills on these low insurance reimbursements? But people seem to really like coming in because of the way we did things differently. So I was trying to troubleshoot a way that I could keep doing it that way and not have to work with the insurance companies. But so that's kind of how I came up with the idea of trying direct care. I figured if I was going to be working for somebody, I'd rather work for somebody than trying to open my own practice and work for the insurance company, because it's a lot of work and I want to be able to do it my way. So
Well, when you were at the previous practice, and
mhm.
you, how many patients were you seeing per hour, and what does your hourly sort of workload look like these days?
Um, I would say the previous practice I could see anywhere between 4 to 6 patients an hour. I mean, a lot of times I would have 5 full exams booked in an hour, and then maybe even try to squeeze like a follow-up in there. I mean, and that's a lot. There's a lot of tech workup that goes in there. You don't really get a chance to really delve into the history and what they're using their eyes for, like what their day-to-day looks like. There's so many details that you can get into. Like even now in my office, I'll ask them like about their computer monitor setups, like what their hobbies are, all sorts of different things that I feel like really can impact their day to day if we can problem solve for them. And so now I book my full exams for an hour. I would say they don't always take an hour, so I may squeeze a follow-up in the 15-minute slot, like a real quick follow-up, in the last 15 minutes of that. But so maybe 1 to 2 an hour. So kids don't take that long either. I'll probably do 2 or 3 kids in an hour. But even still, I mean, they're just pretty straightforward, and I feel like that's plenty of time that I can be done with the patient by the time the next patient's arriving. So,
But when you're seeing 4 to 6 patients an hour like you were in the past,
mhm.
squeezing another one in is quite a bit different than when you're seeing 1 to 2 patients an hour and squeezing one in.
Oh,
How
absolutely.
does that affect like the quality of patient care? I mean, I think how it affects your workload and what the staff has to do is something
Mhm.
that's pretty easy to understand. Like when you're seeing 4 times as many people, you're doing 4 times as many things. But from the
Right. Yeah.
patient standpoint,
Right.
how does having that much more attention affect their experience?
I mean, I've had a lot of people say at my office that they appreciate not feeling like they're being shuffled from room to room, just waiting, feeling like cattle being herded back and forth. So, and I think everybody likes to feel like they're being listened to and understood. And when you have the time for that, then you can do that. And also, if there's an emergency who calls, I mean, we can always see them because we have that time to squeeze them in. And it's not affecting the whole rest of the day. I mean, it can a little bit, but it's easy to get caught up from. And patients, it's we like to be able to see emergencies when they call. So
Excellent. Got a
yeah.
couple of questions
Mhm.
from the audience here. One is, are you doing direct care for vision services only, or are you also doing the direct care model for medical visits?
I think it could work either way, but I do everything. I don't take any insurance at all.
Excellent. And the next question actually feeds right into that. How do you
Mhm.
explain this to your patients? Do you have this as a written policy anywhere? I understand that the benefits as a physician, but I'm trying to figure out how to, quote, sell this model
Right.
to patients.
Yeah, absolutely. I actually think that's the most challenging part. It's really important to do that all up front. And I think it's important to do that without saying the words out of network first. I mean, you do have to tell them you're out of network, but I think explaining on the phone and adding the value in, keeping the conversation really positive about what you're doing, because it really is a benefit to the patient. It makes it so much better for them. The experience is better. I think that you're able to give better care, and just the relationships and their experience in office is better. So if you can kind of add the value into what you're doing before getting to the pricing and out of network, I think that's the best way to do it, instead of just telling them that you're just dropping their insurance. I do have that very upfront. On my website. We have our prices listed. We have all everywhere that it's kind of surprising at this point if somebody comes in and says, "Oh, I didn't realize you take insurance." We're pretty clear about it. When they call, everybody knows to make sure to say like, "Hey, do you know what that we're a direct care office? Let me tell you about what that means." And then we make notes in the chart to make sure that we told them what it was, and what their and what we quoted them. So we're
So a
pretty
lot
clear.
of it is about setting expectations,
Absolutely.
making sure the value is clear, and then following through with that.
Yes, absolutely. I think that's really important because we don't want anybody coming in mad. We want them to know what they're getting when they come in. And I think that that helps people, just helps set the expectations so people are happier. So,
Yeah. What's that website so anyone asking can go and see what it looks like on your
yeah. Oh,
practice's site?
absolutely. Yeah. So my office website is called, well, my office is I Care for You. So the website is I Care, EYE Care, NC, like North Carolina.com. icarenc.com. Yeah.
Awesome.
All the
Uh,
information's there.
Fantastic. We had another follow-up
Mhm.
question. First, thanking you for your response, and then how do you assist your patients with filing medical benefits to their insurance for reimbursement? From my understanding, the patient has to file these, and how are you obtaining out-of-network reimbursement rates for these plans?
So we just tell people that it will probably go towards their deductible if they have a deductible. Most of the time for a specialist copay, what we charge for an office visit is cheaper than what they would have to pay with their insurance. So we usually are just familiar what local copays are. And we just tell them if you have a deductible that it's going to go towards, this will go towards your deductible. And we go ahead and submit. I think we just fill out the form, have them sign it, and then just pop it in the mail.
Awesome. Thank
Yeah,
you. And
yeah.
how do you do that on the vision care side of things?
On the vision care side of things, we use Anagram for everything. And actually, I would say that that's actually a huge benefit when patients are booking their appointments, because we can pull up their live benefits very quickly and easily with Anagram. So if they're asking, like trying to figure out if what the benefit to them is and how much it's going to be, how much their reimbursements are, that's helpful both in the booking the appointment side, and then also when they're purchasing glasses as well, because we could pull up their contact lens and eyeglass benefit. So yes, we do use a lot of Anagram. So
Excellent. That was a little selfish, but it made sense
uh,
in the
I mean, I'm
context.
happy to talk about anagram because when I decided to go direct care in that kind of time, I think it was like 2016, I was thinking like I can't keep taking insurance. I have to find a better way. And true story, I was just scrolling through Facebook and I came up with this ad for like be an early adopter of patch.com, and it was like file out of network benefits, and I was like, what is this? And that was like the early version of anagram. And I really feel like having that, seeing that as an option, made me think like, okay, this is something that's possible. I can do this. So
Yeah,
So
thank you
yeah,
for
so I
that.
appreciate.
That's how we look at it as well. It's, being fully out of network doesn't make sense for everybody in all
No.
circumstances, but
Hmm.
at the very least, we help provide like the mechanism by which you can evaluate your vision plan relationships, and some that make sense still make sense when you're using Anagram, and some that, just don't make sense to be in network with, make sense to
Hmm.
step away from. But I think as a patient, taking off my anagram hat for a second, as a patient, I like the idea and the feeling of having a relationship with my provider. Like
Yeah.
I look at insurances, and this is true, in with primary care as well as eye care. Insurance is often a barrier. Like I feel like I have to go through it for healthcare purposes
Right.
because everything is so expensive, and I have no idea what
Right.
it's going to cost me to do anything.
Hmm.
But once I find a doctor that I like, whose opinion I respect, who communicates with me like a whole person and not a number or a paycheck,
Hmm.
I stay with them.
Yeah.
How does that sort of reflect your experience on the other side of the desk?
I really do feel like patients have been really happy. I mean, there are the patients that I saw in the first 2 years before we stopped taking insurance. I mean, as far as I can tell, most of them are still coming in. They were probably the hardest to explain to because we had taken their insurance for a few years and then dropped it. But they also had kind of known the way we did things at our office, and I think they understood that we wanted to be different. So and they were patient with us as we were kind of honing our skills of explaining why we were not taking their insurance. Because like I said, I think keeping it positive is critical. So you can't just say, well, I mean, they weren't paying us well enough, so we decided to get, patients don't care about that. They just want to know that we're trying to spend more time. We want to be able to do things and not be so restricted by, they understand insurance companies trying to be restrictive. So I feel like that's really the kind of explanation that hits home best with them. So,
I think today it seems like there's a bit of a sea change, or like a perspective shift among customers, patients, consumers looking, at least from my perspective, and I've seen studies to suggest that this is the case, looking to support local more
yeah.
often.
Hmm.
As an elder millennial, I know that, we ruin Applebee's and jewelry stores and all that
All
stuff, as
right.
it's
Yeah.
how we go about it. But I think I can't really speak for millennials, but I prefer to shop local and know that
Hmm.
where I'm spending my time and resources benefits the community in which I live and work.
Yeah.
Do you find that to be the case as well?
Absolutely. Yes, I do have a lot of people who tell me that they like supporting local. And a lot of people even ask me if I plan to get bigger. Or, I hired a part-time doctor not too long ago, just to work, she works 2 days a week and she covers for me with vacations. But people got a little nervous then. They're like, you're not gonna get bigger or get, and I said, no, I just want to be able to take a vacation. And she's wonderful too. So I think that kind of adds to it a lot. I do feel like people get worried and they ask me, they like to come in because we're local. And I'm kind of active in the community as well. I live just the next town over and, we sponsor like my kids' school and all that stuff. So, lots of stuff like that. And I think people appreciate that.
Yeah. How do you sort of weigh the ROI of something like that? I know in the industry for a long time, marketing dollars are sort of nebulous in how they're spent.
Hmm.
And
Yeah.
it's difficult when your margins are super thin to spend money on just like branding. How do you think
Yeah.
about it? How do you conceptualize what to sponsor, and how much to do it, and like, whether it's worth it or not? And I know that's kind of a nebulous question, but I
Yeah.
think just getting your take on it would be helpful.
I'd say, I guess it is kind of, it's hard to tell, right? Because you never know, like, are people actually coming in from it? And I don't know that, I do ask people if they're coming, how they heard about us. And I really do feel like most of our patients come in through word of mouth. Not a lot of people actually come in through these like school sponsorships. I mean, I get my daughter's school emails every week and I Care for You is their big, but I don't know that anybody has actually come in from that. So, we get a lot of like requests to sponsor swim teams, and depending on it's kind of just we play it by ear. If we're getting a ton, we can't do them all. But if it's a patient who we've been with for a long time, or who've been with us for a long time, they've referred a lot of people to us, and it's not a big ask, then absolutely we will. Just because I feel like that might help them, the patient, be more likely to refer to us versus the actual cost of the sponsorship and having our just logo out there and have people Google us. So it's
Right.
like the positive value that it's adding with the patients. So.
And how do you have a formal sort of referral program of any kind? How do you ask for referrals, or do you ask for referrals in any formal way, or is it just, providing the best possible service and letting promoters promote?
Yeah, we don't really. No, we just try to provide the best possible service and let promoters promote. Yeah.
Okay, great. I've got a question from the audience. How do you submit for a patient that doesn't have one of the plans handled by Anagram? I'm in New Jersey. New Jersey Direct covers at least the exam for a patient, and I'd like to be able to offer submitting on their behalf.
So we would go to the website, find the out of network form and print that off and just have it filled out. Like we might print it off while the patient is in the office, like if they came in and gave us their card at the beginning at check-in. And then while they're back in the exam, my front desk would, print it out, get it filled out, and then have them sign when they're checking out. And then we'll just drop it in the mail and send it off for them. So it's not a ton of extra work because we just do it while they're there and there's not a ton of extra people in the office. So it's not too much extra paperwork, but for people that aren't, it's not supported by Anagram, then that's what we do.
And I think that's something that your practice is able to do precisely because you're not seeing 6 patients an hour. You've
Right.
got the time to
Yeah.
do those like specific
Right.
patient-centric activities.
Which is why I think it would be beneficial for new practices starting with direct care to it'd be easier, I guess, I shouldn't, it would be beneficial but easier to implement. It's a little bit more of a change to the system for big practices been operating a certain way, but I do think it's possible, and I do think when you drop insurances you do lose some of the people who are maybe time sucks, but not really actually benefiting your office all that much. And so you do get back a little bit of that time without losing money on those patients. So,
I think that's such an important thing to kind of land on for a little bit because there are the sort of obvious costs of being in network with vision plan and medical plans, and there are the kind of hidden costs of
hmm
that. I think the added workload is kind of a hidden cost because it's difficult to understand where the break-even point is. And
hmm
something that I find with practices that are in network with a lot of plans or maybe too many plans is
hmm
they end up having to see more patients in order to stay profitable, having to hire more staff in order to
hmm
see more patients, and then having to see more patients in order to hire more staff. And it ends
hmm
up in this kind of death spiral where,
hmm yeah,
the tail is wagging the dog, so to
yeah,
speak.
yeah.
You're never getting up for air.
It's a
It's
vicious
just
cycle. Yeah.
yeah. So, in that event, where would you suggest a practice, begin? Because it's no surprise, a lot of the practices we talk to and even don't talk to, you see it all over the various fora on the internet, is everyone's upset at the vision plans for the reimbursement staying stagnant for over 20 years for the most part. Everyone's
hmm
upset that they kind of have to take it. What piece of advice would you give to them to get started, to take that first step?
Um, I would say identify your lowest paying plan, the one that gives you the most headaches. And then just start preparing, maybe 3 to 6 months out. Write a letter that you can send to your patients that you say that you're going to let them know you're going to drop their insurance plan. Give them time to use their benefits if they need to, or if they want to use in network. But just explain your reasons in the positive way the positive kind of ways that we've talked about, to explain that you just can no longer take that insurance plan and still provide the same kind of care that you want to provide. I think that you'll still get the patients who you want to see. And I don't think you'll lose a lot of money. Start with that, And that will really help train your team to explain why you're not taking their insurance. And then after a few, it'll make it a little easier to get the ball rolling and then drop like the next worst one. And it'll really help free up some time. And as you're doing that, maybe for patients who schedule out of network, um, block a little bit longer exam time. Start changing your exam time so that the people who are doing that self-pay rate have a little bit more time so that you're able to really give that good patient experience. Because I think you also have to follow up with the good patient experience when they come in the office too. So
Right.
yeah,
Yeah. Yeah. Building
yeah,
those promoters, right?
right,
By giving
right.
them that kind of experience that you want to give them.
Yeah, absolutely. Yeah. So once you've explained it so on the phone, this is where it would be slightly challenging for a more established practice to drop. But if you slowly drop and then book them in those longer slots and kind of do things a little differently for those people, I think that will help slowly get rid of the worse insurances and more build the more direct care and more self-pay patients. So,
So thank you. So there's a conversation that I have pretty regularly with practitioners or practices thinking about stepping away from vision plans. And one of
hmm
the biggest sort of fear points is, well, if I drop this plan, I'm going to lose most of those patients. And while, that may be the case,
hmm
a lot of the patients that will chase their vision plan in network are the ones that are in your practice right now saying, I only want what's covered by my plan.
right.
The ones that think they belong to the vision plan and the vision plan agrees. But
hmm
the ones who come to see you because you're you, as
hmm
long as you make it easy for them, will continue to see you.
Absolutely. Yeah, absolutely. Yeah. Well, and if you think about it too, like say you charge, $139 for an exam and you get paid a third of that through whatever insurance plan. I mean, you could lose two-thirds of those patients and have one patient pay your full exam price. They will still get their exam fees or their out-of-network reimbursement back. So it's not, but you get paid up front. You can take a third of the time and make the same amount of money. And that just frees up so much more time. So, and then you're getting, not only is it freeing up more time, but you're getting rid of headaches too.
Yeah,
So,
that's another element of the hidden cost
yeah,
of it because, like you
yeah.
said, you're getting paid up front. There's
hmm
no reconciliation,
Oh,
no
yeah.
EOB, no remittance to have to
hmm
deal with and write
hmm
off. Like
hmm hmm
it's not just that one out of every three patients makes up for the lost revenue,
Yeah,
but you actually come out further ahead because it takes
yeah.
you less work to do it.
Which less team members to do that and less chance of having potential, you know, interactions between, it's hard to find the perfect blend of team members and everybody that works together really well. And the more personalities you have, the more challenging that could be. So to keep it small is not, and patients like that too, more people, more turnover. Keeping it small, you're more likely to have your team be happy, keep people longer, and then patients come in, see the same people year after year. It just adds that whole sense of community sort of that I think people appreciate and really has been lost in a lot of healthcare, over the last however many years. So, another thing that came to mind when you were talking about the other added benefits too is, I feel with, in the optical department that makes a difference too, because it is challenging to do optical with insurance companies because you have to use their labs. And I surprisingly found with two different labs that if you used insurance or if you went with self-pay, you got much better quality products and customer service under the self-pay, same lab. So the products under the insurance, the products would take longer. They would come back not as good, not as nicely have made. And then that reflects on your office as well. It's coming from you. You want to say that it's good. And then the labs charged you for that. They would take the copays that you get from your patients, which is all you're really making on their exam or on everything of them coming in, and they would charge you for that. That's what you would have to pay. I mean, it just doesn't make any sense. Um,
Well, yeah, that's an element of this that I think
yeah,
often gets overlooked is labs that are also credentialed with vision plans run into kind of the same problems that we were talking about before.
yeah.
If you're seeing six patients an hour or, the equivalent of being much more busy in order to make up that same
Mhm.
amount of revenue, the labs have to do a similar kind of math.
Yeah.
They do way more work to make the same amount of money, but to your
Mhm.
point, when you become a private pay customer or self-pay customer of the lab, they give you more time because
Hmm.
you are more valuable. And,
That's
and
true. Yeah.
it's not the lab being unfair. It's the
Yeah.
lab giving their actual customer their
Right.
attention.
Right. Right. Yeah. I mean, it's been pretty impressive, the better quality results that we've had with the lab. And I mean, the vision plans don't want you to think this, but they're much more willing to work with pricing on a self-pay office. They prefer to work just like we prefer to work with patients who are self-pay. Though they give you better pricing than you're led to believe that they will. So
Yeah, it's such an important point, from running a business, and it's logical. It makes sense if you're,
Mhm.
if you send a lab, let's say for the sake of math, 100 jobs a day, and
Right.
90 of those jobs are insurance jobs, then the practice really has 10 private pay jobs from you. If you're able to double that,
Hmm.
you give them 20 private pay jobs a day, they're making almost double what they were from you sending 100.
Yeah.
So now you're sending
Yeah.
110 jobs, and they're almost making double than they were when you were making
Right.
100.
So how
So,
could
and
they do the
it
same quality?
exactly,
Yeah,
exactly
same with
right.
our exams. Yeah, how could we possibly? Even though our intentions are there, we want to do the best we can. It's just not enough time in the day. And then you go home at the end of the day, you feel exhausted, you don't feel like you did your best work, and you don't have that to give to your family too.
That's such an important point also. So if you could talk a little bit about burnout, about what it's like when you're seeing 6 patients an hour versus how you feel at the end of the day seeing maybe 2 patients an hour.
Yeah, I mean, it's just exhausting. You don't have time to go to the bathroom or eat a snack. You finish your chart notes during your supposed lunch break. You get home, you have to stay after to finish your chart notes. I mean, now I can finish my notes while I'm with the patient. I just make a little bit of small talk with them, which they appreciate because I'm kind of getting to know them while I'm kind of finishing up my notes. And I can go home right at 5 o'clock at the end of the day and be home at 5:15 and have dinner ready by 6:30, because I take forever in the kitchen, but take forever doing everything I do. But yeah, I just think that it's just not as enjoyable of a day for anybody. So and it reflects to the patients too. They can see that. So and I can't tell you how many patients comment on they can tell that my team is happy to work where they are, and I tell them I'm happy to have them. I have a really great team and I couldn't do it without them. So but I also do want to keep it small. I want to have really good people. I want to keep it small. I don't want to grow too much. It's a balance, but I think we're that's the struggle, right? Is finding that right balance. So um
Well, actually, speaking of your staff, so when you
mhm,
opened your practice, you did some vision insurance stuff for a couple of years,
mhm,
and then gradually stepped away.
mhm.
Is everyone who was on your team then still on your team now, or what did that transition look like?
Not really. Most are. Well, I started off with a really small team. And I was looking at having to add I was looking at having to add an insurance biller. That's what made me decide to go to direct care. But it seems so silly because you're not really getting paid at reimbursements enough to afford to add an insurance biller. So I don't have the same optician, but the optician who I had come shortly after that is still with me, and now she's my office manager. And for a while, me and her did quite a bit of it on our own. And then we've had a little bit of turnover in the front desk, only because I feel like that is something I have been learning as an employer as well as is interviewing and finding the right people. And so now I really feel like we in place the last couple of years we've really had a really fabulous team, and patients notice it too. And but everybody's been with me and seems pretty consistent. And I about 2.5 years ago, no, 3 years, no, 2 years ago, I added that part-time doctor, and that's just we've just kind of found that right balance now, I think. So yeah, I
Awesome.
don't
Well,
plan to have anybody else. Mhm.
that's such an
Sorry.
interesting point that you bring up about the insurance biller, actually, because we didn't even talk about that as
Right.
another. I guess
Mhm.
it's not really a hidden
Mhm.
cost, but that's a cost that your practice does not incur because
Yeah.
you're not dealing with billing
Oh
insurance,
yeah,
where it's
no.
somebody's full-time job to do
Right.
that
Yeah.
work in a lot
Yeah.
of places, and often teams of people.
Yeah, absolutely. And can you imagine like how frustrating it must be to like talk on the phone to the insurance companies all day? Yeah, I mean that's a frustrating end of your day. So
Yeah, it's not something I'd want to do, that's for sure.
no, no.
What would you say as you were moving toward the direct care model? What would you say were the biggest challenges or obstacles in moving in that direction?
Um, Really, it took a little while to fine-tune our script of what we were going to say because patients had a lot of questions, rightly so. And we had to make sure that we were answering them, being concise about it, keeping it positive, and helping them really understand the value of what they were getting. Because I think that when people hear out of network, it's just like they shut down immediately. That's all they hear, shut down. So we kind of had to go in and build a script and practice that and rehearse it with each other. And even when we've added new people, we've stood in the back and called them and, had them go through the process to make sure that they feel comfortable saying it. And so I think all of that that would probably be the biggest challenge. But once we got a handle on doing that, I felt like it has gone much more smoothly. So, and once in a while we have people who don't want to book, and that's okay. But a lot of times people call now, and because they have been referred by somebody who's come in, they kind of already have this inherent sense of trust that they want to give us a try. So people call because they have heard of us for some reason, whether they read our Google reviews or they heard from somebody else. So they're willing to listen to why we do things differently. um it's just
That's such an important point.
yeah, 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 it's just
Where these days, people they don't call just cause,
no,
nobody likes to
no,
be on the phone,
no one
generally
calls.
speaking. So if
Yeah.
they've made a phone call, they've already had a series of decisions before
Right,
they ever picked up the
right,
phone to call you.
absolutely. Hmm. Yeah, so I think that just puts it on us to make sure that and actually I have that in one of my direct care training presentations, these moments of truth, where there's like the zero moment of truth, the first moment of truth, and I believe it's the second moment of truth is when they actually like zero moment of truth is when they have the first impression of your office, usually like through the device. I think the first moment of truth is when they like talk about your office or they hear about your office from somebody. And then the second moment of truth is when they call. So they actually have a lot of impressions formed of your office before they even call. So you just have to follow up with like these good impressions because they called because they've obviously heard some good impressions, being consistent with that. And then I also feel like, a lot of it is being consistent with that when they're in the office too. You can't like go through all of this process and have them be real excited to come to your office and you've explained like, oh, direct care is so great, we're going to take good care of you, and then they come in and nobody looks at them for 5 minutes when they walk in and they just stand there awkwardly at the front. You have to address them right away, keep things moving quickly, and just make it a kind of good, well-rounded experience for them.
Yeah, that's so true. What would you say your average patient is looking for in a good experience? Like, how would they define a great experience at the eye doctor?
Yeah, I mean, I think just being treated like a person and having no extra bills. I always tell people, like the people who work at my office, like I feel like when patients come in, like it's like somebody who comes into my house. I would never like if somebody walked into my front door, I wouldn't just like leave them sitting there at the front. If nobody's addressing them, I'll walk up to the front and be like, "Hi, can I help get you checked in?" Or, you know, we have a little mini fridge at the front and offer them waters and we have a couple chairs up at the front for a waiting room, but we try not to let them sit in there for too long. We don't have a super long check-in process. I think nobody really likes that. When they come to the front desk, we verify their address and phone number. We have them sign a HIPAA, and then if pretest is available, we take them straight back into pretest, get them a drink, and kind of like keep that flowing. So we try to be very aware of who's in the office at all times so that nobody is waiting in any one room for a long time. And a lot of times, I mean, I always make notes about patients about, just something brief that we talked about so that I can follow up on that. Or did, their friend refer them? I like to know all of that. If say a mom brought her kid in last week and now she's coming in for herself this week, I don't want to address her like she's a new patient. I have to know that I talked to her last week. So all of those things I think add the value in. So just things people want to know that they're being remembered, and I think we all do. So
Yeah, it's often it is a relationship, and you kind of want to do all the things that you do in any relationship to make it strong and make it impactful.
Absolutely.
The metaphor, the analogy of people coming into your house, like if somebody came through your front door, it would be super weird if you didn't say anything to them.
Yeah.
It would,
That's what I feel
so
like when people come into the office, and I think my team does too, and that's what I try to impress upon them. It's important to treat them like guests in your home. I mean, it feels like a home, and I also try to make my physical office like space kind of like a cozier, less medical feeling sort of. I mean, it's clearly an eye doctor's office, but less of that like medical feeling too. And what you said before kind of triggered something for me. Building on like those relationships, I think when you have that trust feeling, patients are more likely, when they trust you, they're more likely to follow your recommendations. It really builds on like patient compliance and even like return them coming back year after year, taking your recommendations for both their health and their optical needs. So I think all of that kind of ties back together too. With the trust.
Yeah, absolutely. It's such a good point because when you're talking with a patient who's in network or who's constantly there's this constant back and forth between you and them and their insurance company,
Mhm.
there's kind of that odd disjointed feeling of, am I being recommended this because it's necessary for me,
Right,
or am I being recommended this because the practice has to optimize their revenue? And maybe
right.
that's I'm a little biased because of the
No,
industry in which
yeah.
I work, but
Mhm.
like that's how I think about these conversations. Whereas if I'm talking to a doctor with whom I have a relationship, who I trust, I just listen to their recommendations and go, okay, let's do that thing then.
Yeah, and I print out everybody's prescription at the end. I write my recommendations on the prescription, but I'll print it out at the end. I pull it off my printer that I have in the exam room and I hand it to them and I show them what my recommendations are. And it's that part is really just following up on what we've talked about throughout the entire exam, as far as I've asked them like kind of what their hobbies are, what their work setup is like. And I think they really understand that I'm trying to help problem solve what their issues are. I mean, think about how much we use our eyes. I mean, all day, and so many people are working from home and at the computer, and um, there's a lot of potential issues that could create in their day to day that I think that we have the opportunity to help solve, and having the time to do that can really improve their lives and day to day. So when you can kind of show them that in the exam room in that way, then I think that will also help build the trust as well and help them value your recommendations. So I do
Yeah,
all sorts of
absolutely.
crazy things. I had a guy bring after hours, or right at the end of the day actually, when nobody was there. We had him bring his like archery bow in, and we like had him stand and look down the hallway and took all these measurements, so like all sorts of different, I don't know, you get all sorts of requests, and lots of engineering type personalities that will come in with like their requests. But I think people just want to be listened to, and when you have the time to listen to them, they really value that. So you just have to explain. I've had people tell me they need like a 5-degree axis difference on really low astigmatism. I'm like, you're not going to notice that, but I can actually like show them. I have time to show them and be like, see, you don't notice the difference, and they're like, oh, okay, yeah. But
That's so valuable. And to
yeah.
your point, where people want to be heard, they want to participate, like what, especially when money is involved, in a way that
Right, of
they
course,
feel
yeah.
like they're being listened to. Like, and again, I'm sort of nuts, so my personal experiences are what they are. But there are plenty of times when I walk into a store to buy like a shirt, and the way retail experiences are these days, like you're at a Macy's and it's a 20,000 square foot store, and I've got a shirt and there is one open register with 40 people stacked up behind it. Like,
Hmm.
it is not worth my time
Oh,
to stand there and wait to buy the shirt. So I
no,
put it back and leave.
right,
Because it's clear that Macy's doesn't care whether or not I'm a customer there.
right.
But sort of the opposite of that is, if I went to an eye doctor and said, "Hey, I'd love to have custom like archery eyewear," and she spent the time to let me
Yeah,
come in with my bow in a way that wouldn't freak anybody out,
yeah,
she'd be my eye doctor forever. That would be amazing.
yeah, yeah. Yeah, well, I feel the same. I think especially because of, having my own office that we try to provide really good customer service. I think that I also have high expectations of other doctors' offices, so I really try to find a lot more like maybe direct primary care. My primary care is direct care and she's wonderful. But if my daughter gets sick, I can text her and she'll call me over an antibiotic or she'll whatever she needs. I mean, she's wonderful. My daughter broke her arm on her birthday when she turned 7 because we got our new bike, so we had it on video because she was riding her bike. She turned the corner too fast, fell down. We recorded it. It was a Saturday night, of course, so I called the doctor. I texted her. I texted her the video, and she said, nope, you need to go to the ER. She's like, I can see it. It was broken, but she was there and available. She was like, if you can't get to the ER tonight, like take some paint sticks and a magazine and tape it up. And I was like, okay. But I mean, to
Yeah,
have that experience is wonderful. And I appreciate that kind of, that kind of service. So
it makes such a difference because it's a relationship. It's an actual relationship instead of a sort of contractual one.
yeah, yeah, absolutely. Well, and it's just the feeling like you're a person, small shopping at small local stores versus like the big stores, people like to feel like they're being appreciated where they spend their money too. So, and I think they are willing to spend the money on products and quality products that they they take our recommendations on what's quality because we know what they are. And they're willing to spend the money if we can really show that to them. And when we have the time to explain it, then that goes a long way. So
Awesome. I've got a couple more questions from the
okay.
audience. Do you find you can always answer the question of whether they have out-of-network benefits or not, specifically if their insurance isn't listed in Anagram?
We tell them whether or not it's listed in anagram that it's never a guarantee. So, we always tell them it's not a guarantee. So we also will be kind of familiar with what like whatever plan it is, what their out of network, what their local out of network reimbursements are. So we'll tell them, oh, you know what, it's not coming up in anagram. Although honestly, that has not been happening all that often. In the last couple years with the anagrams newer updates. But we would know what our typical out of network reimbursements are and tell them, maybe you may get about $45 back out of network, but it's not guaranteed. It will come back to your house. We tell people to plan to take for it about 4 to 6 weeks. So they're not calling you back next week asking. So, and either they get it back or they forget, so we don't get a lot of calls back on well, although I will say it's very important to make notes that you filed it so that when they call back and say, did you file it? You say, yes, we filed on, January 21st. So,
Awesome. And then another question, you'd mentioned your direct care difference courses or seminars. Could you share a little bit more information about that?
oh yeah, yeah. Well, just doing this direct care, and seeing so much kind of unrest about the industry about taking insurances, I just really felt motivated to put together something that could help it be possible for other optometrists to see that it is doable. It doesn't have to be all done at once. If you're starting cold start, it might be easier to do it cold, than go in and then drop. But I think it's doable. So I put together these seminars, just going through the training, all the scripts that we've used and kind of honed and fine-tuned over the years. I have a couple different like how to file out of network with insurances, kind of how to have create that patient experience while they're in the office. And I think the most important ones really are the phone technique and phone kind of training. And then also there's some training in optical as well. So because I think those are the biggest kind of stumbling points, the phone explaining when they come in, and then also like trying to sell the glasses at the end. So I put together 5 different training webinars, and then also all the scripts that I've used, kind of fine-tuned over the years, into kind of a little package that I put on my website, the directcaredifference.com. So, but it's really just everything that I've kind of learned over the years, and I just want to share it with people because it's doable. And not only is it doable, but it will make your day happier. And it not only will make your day happier, your patients will be happier, your team will be happier. And I think it can really slowly trickle down effect, improve the healthcare system because it's really just a nicer way to practice. And I think you can get better quality care. So, this might be a far reach to say all of that, but I really feel like it can make a big difference. So, yeah.
Awesome.
Yeah. So.
All right, one more question from the audience. I used to utilize Patch before it became Anagram, and the office I managed submitted so many out-of-network claims that VSP cut off their payments to customers. Have you encountered any issues like that?
I do remember when that happened, but I think that's been overcome. That has not been an issue lately. But yes, I was around when that happened as well. And I'm trying to remember what we did at the time because it's been a couple years. I think we just printed off at the time our EMR software, we got some like CMS forms and we just printed the CMS forms and submitted them directly to VSP. That way. But I think that's been overcome with Anagram, right? VSP did
Yeah,
give them
it's
a hard
it's
time
not
for
an
a
issue
while.
that we've
Yeah.
run into in a while, but I wanted to
Okay.
make sure that the question was asked because I think it's an
Absolutely.
important one.
Yeah.
In
Yeah.
general, everybody who's thinking about using Anagram or any other toolkit to help you deal with insurances,
Right.
we do our very best to provide as clear information as we can, as clear guidance as we can on how
Right.
to do everything and how to optimize it.
Hmm.
Unfortunately, we deal with insurance companies just like you do, and then the
Right.
decisions that they make are often out of our control, but we work incredibly diligently to
Absolutely.
make this as effective as possible.
Well, I mean, they're not trying to support us in this area. So I think that they are, especially VSP being the big industry that they are, I think they were really trying to shut down the whole system there. It kind of felt like so, but I do think having a backup plan is to be able to file and you can just know what those expectations are. Say it's a $45 reimbursement, print either on VSP's website, the out of network form, there's a real quick one-page form, have the patient sign, pop it in the mail. And then, or just get those CMS forms. You can even order them on Amazon, I know. And then you could print those out and just through your EMR, pop that in the mail. I mean, and we've had a few when we're doing it that way, rejections that came back. There was a little bit of a weird time there, but for the most part, I feel like that's resolved. I'm not seeing a lot of those VSP or any of them rejections come in anymore. So for now, I'm sure they're
Yeah,
working though. There'll be ups and downs.
there, of course, yeah. There was
Yeah.
a period early last year where VSP moved their claim processing center from, I think, Alabama to Cincinnati, Ohio,
Okay.
and that created a bit of a log jam, and it was just an operational thing that VSP did that had
Mhm.
certainly nothing to do with us. But we
Right.
sent out messages to our customers every week, informing them of kind of the statuses as we knew it, and keeping everybody in the loop about what was happening. But those are things that you just run into from time to time. But in general, for anyone kind of interested with Anagram, our utilization has never been higher among our customers, and our NPS score, our customer satisfaction, has also never been higher.
Mhm.
So it's been a real fun journey to be a part of,
Mhm.
actually.
Yeah, and I can speak to that. I mean, it has been really easy. We brought in a when we brought in a year or two ago and our front desk who's wonderful. She had no experience in eye care at all, and she was able to pick up using Anagram really easy. Um, especially I know that you've come up with that new open access. I think that's really helpful and easy to use. It's so easy to find the plans and it's just straightforward. Everything's all in one place. It makes it very doable while the patient's on the phone to come up with their out of network benefits. So we've been very pleased with it. Like I said, I think it has really helped facilitate this whole process. So
Thank you.
yeah, thank
Fantastic.
you. Thank you.
Um, is there any other, as we're approaching the top of the hour, is there any other piece of advice you'd want to give to the audience about direct care, about optimizing patient outcomes, about kind of the future of eye care as you see it? Anything you'd like to share?
I mean, really just not to be afraid to try. I think that the biggest thing is fear, and just start small. Start small, start with your worst plan, and just know that the patients who love you will keep coming back. Just keep the conversation positive and know that people really value your services. It's not just about the insurance companies, even though they want you to think it is. So people love you and your office. It's not the insurances. So don't be afraid.
That's such a important piece of advice, actually. Like, I've been in the eye care industry for over 20 years, and the most consistent thing that I'm fortunate in this industry to deal with is that optometrists, opticians, eye care professionals in general really care about their patients. I mean,
Yes,
it's not just
absolutely.
a thing
Yes.
that people say.
No.
And this is a method by which you can do care in a better way. And
Yes.
that is such a tremendous opportunity for patients to experience, of course, for doctors to experience that ability to do so, and in a way that is easier for them to have a work-life balance, to be more
Mhm.
profitable. So I want to thank you so much for your time. Thank you for all the work that you do with Direct Care Difference and certainly in your practice as well. Thank you to everybody for attending. If anybody in the audience wants to reach out to you, what's the best way to get in touch?
You can email me at drkara@directcaredifference.com. And if you have any questions, there's a lot of information on my website as well, but I'm also happy to answer questions. So just please shoot me an email. I'd be happy to get back to you and kind of, troubleshoot some ideas. So, but yes, I wanted to say thank you all for joining and thank you, Steve, for hosting me today. I'm really happy to be able to share my story about direct care with you guys. So thank you.
It's my pleasure. And everybody, if you'd like to reach out to me, it's steve@anagram.care, anagram.care. If you have any questions, thank you, Mary Kate. It was a pleasure. It's a great webinar. Thank you.
Thank you. Thank you.
So yeah, anagram.care, if you guys want to sign up for open access or learn a bit more about it, we actually also launched Universal Search pretty recently, which is a brand new, super cool feature. Come check it out. Thanks, everybody. Have a great rest of your Sunday.
Have a great day. Thank you.
Bye, guys.